Hey everyone, it's Lee from Trailside Fitness. Today we're going to talk about what causes hip pain for hikers and some things you can do to help fix it. Stay tuned. Just a quick note before we get started. If you are experiencing any pain in your hip, it is your responsibility to make sure that you see a medical provider. This video isn't intended to diagnose or treat any specific hip pain that you're having. So there are a few different things that can cause hip pain. One of the most common is just an imbalance in the muscles that surround the hip. That could mean a muscle that's tight somewhere or one that's maybe not quite as strong as it could be. So to start our discussion with the hip, we're actually going to move down and take a look at the foot, since the foot and the hip are tied together. For our purposes, the term overpronation is just going to mean that the foot overflattens when you put weight on top of it. So what does this over-flattening do at the hip? We have a saying in physical therapy that what happens at the foot happens at the hip. So to take kind of a visual look at what's happening when that foot overflattens, this would be your left leg. That foot's going to flatten, and that's going to cause an inward rotation for that lower leg bone, which is going to be felt in the knee, and that's going to translate up to the hip itself. And depending on how the hips are positioned, that's going to affect the efficiency of movement in that ball socket. So let's take a really quick look at hip position and what that means to us as hikers. So in an effort to keep things simple and not overcomplicate this, if the muscles on the front of your body are tight, it's going to tilt your hips forward. And if the muscles on the back side are tight, it's going to tilt the hips backward. Ideally, we'd like the hips to be in a neutral or middle position, so neither the muscles in the front or the back would be tight, but just kind of their normal resting tone. This will have ramifications as to how well the hip and the body itself moves. So we're going to take a quick look at some anatomy and see how that might factor into your hip pain. One of the first muscle groups that we're going to look at is the iliopsoas. This muscle group is actually two muscles that blend together in the front of the hip. The psoas portion connects to the lumbar vertebrae and the discs in between. It's got some little ties into there. It's going to come into the iliacus, which lives inside of the hip bone, and it's going to anchor inside of your lower leg. So think something like this. When you're hiking uphill, that hip flexor complex is going to contract and swing your leg upward. Looking at the front side of the hip, we've got our quad muscles, and there are 4, believe it or not, that attach at different spots along the hip. One of them is a little bit higher up, and the other's a little bit lower. But they all come into one common tendon that the kneecap floats in, and then that tendon anchors on your lower leg bone. So they're going to come across the front this way. All right, let's take a quick look at the glutes. You have 3 that we're going to talk about specifically. There's kind of a large, a medium, and a small that cover this whole area. And it'll go from your tailbone and have all kinds of real estate on the side of your hip and then tie into different points along the outside of your leg bone. When you walk, all 3 of these glutes work to swing your leg out away from your body a little bit, swing your leg behind you, and rotate the ball in the socket. Looking at the back of the leg, we've got our hamstrings, and they all have one common attachment point, which is at the base of your sit bone. From there, the 3 different hamstrings are going to come down and anchor on different spots on your lower leg bone. So something like this. One of the muscles runs to the outside, and 2 of them anchor on the inside. These muscles help to bend your knee as well as move that leg behind you when you walk, but it's not nearly as efficient as the glute muscles at doing that. Muscles have what we call an agonist-antagonist relationship. That basically means that while one muscle group is working, there's another group that has to oppose it in some way. If we look at the knee in particular, if you bend your knee, the muscles on the back of the leg contract, and the ones on the front have to relax to allow that motion to occur. As they're relaxing though, they're controlling and helping stabilize the knee joint. As you straighten your leg out, the hamstrings will relax, and the quads will start to engage to do their work. It keeps a certain amount of tension through the joint so that it works efficiently and smoothly. As effective as this antagonist-agonist relationship is, sometimes relationships have problems. If one muscle is tight or has a higher tone to it, that means that the muscle that opposes it may not be getting enough signal to actually engage and help to keep the balance. This happens a lot with the iliopsoas, the muscle on the front side, and the muscles in your hip, the glutes. Let's talk about how that affects the hip itself. If the iliopsoas is tight, the glute muscles won't get enough signal to fire efficiently, which means you're not rotating and moving that leg in a way that's most efficient for you. The body will use the hamstrings, which are on the back of the leg, to help assist this movement. The downside is when the hamstrings contract, they don't have the ability to rotate and swing this leg away in the socket like the glutes do. Instead, it kind of pushes the ball forward in the socket a little bit, and that can create a pinch or maybe a deep, dull ache in the front of the hip. So what does this all mean for hikers? Well, one, we want to look at addressing whatever tightness issues we may have, whether that's the front of the hip, and sometimes the hamstrings feel tight too. And also, how can we work to strengthen the hip so that everything just moves more efficiently? And that's what we're going to get to next. So now that we've got some of the moving parts out of the way, isn't that humorous? Let's take a look at ways we can strengthen the hip to address some of these problems. Okay, so strength exercises aren't going to change a whole lot for hikers. It's going to be the run-of-the-mill lunges, squats, deadlifts, single leg deadlifts, step-ups, and all the variations in between. Other areas we're going to want to look at are core strength, because if your core isn't nice and strong, it is actually going to affect how your brain is engaging different muscle groups, like your hamstrings, for example. Now, as far as exercises for the core goes, it's going to be your run-of-the-mill exercises there also. Side planks, front planks, farmer carries, sled pushes, yoga. I mean, there's a ton of different things you could do for core strength. Just make sure that's incorporated into your training. Now, as long-distance hikers, it's nice to have good, strong feet, so we're going to look at some exercises to target that. One thing to note is that the more miles you put in and the heavier your pack is, the more apt those muscles in your feet are to tire out. And that means toward the end of the day, you may be over-flattening or over-pronating more than in the morning. So in some cases, an orthotic may be completely acceptable. In other cases, you just may need to work on strength and address some of the endurance for the foot itself. All right, hikers, that's going to cover it for the hip pain video. If you look in the description below, you'll find links for the different exercises that I recommended for you guys. Also, if you have any questions or comments, feel free to reach out. And if you'd like me to cover a specific topic, feel free to leave that in the comments as well. I do have a lot more videos planned and some other great stuff coming your way, so make sure and stay tuned. Happy trails.